Hello, my name is Dr. Deirdre Fetherstonhaugh and I'm the Deputy Chair of the University Human Ethics Committee here at La Trobe University, and I'm also a researcher in the Faculty of Health Sciences. I'm going to talk to you today just about human research and ethics. All interaction that's involved in human research has ethical implications, and these need to be considered for any research. And it's more about ethical conduct in research is more than doing the right thing. People need to act in the right spirit out of an abiding respect and concern for others. And this is encapsulated in the national statement. So human research, what is it? Human research is conducted with or about people or their data or tissue. Now, sometimes human research presents very little risk, but it can potentially involve significant risk and possible harm. And research participants enter into a relationship with researchers that's based on trust, and therefore it is important to protect research participants, because often people contribute as participants in human research altruistically without thought of their own recompense, so we need to consider that we are respecting them. So what do I mean by participation in research? Well, there are many ways that human beings can participate. Firstly, you might be participating in surveys, interviews or focus groups. You might be doing psychological or physiological or medical testing or even treatment. It might be observations. This is what happens in ethnographic studies when people observe human behaviour. Participation may also mean access to personal documents or other materials about the person. It might involve the collection and use of body organs, tissues or fluids, and these sorts of things are skin, blood, urine, saliva, hair, bones, tumour and any other biopsy specimens. Participation also might involve access to a person's information as part of an existing published or unpublished source of or database. Now, why is ethics important in research? Well, since the 1970s, there's been increased attention given to ethical reflection about human research, and this often came out of there were several examples of research that was conducted quite unethically, which include the American Tuskegee study, which involved a group of poor black men in Mississippi who were subjected to decades of non-treatment for syphilis so that doctors could document the course of the disease, even though the information about treatment was already available. Now, this study went for 40 years. So the main thing about this was that the men in the study weren't informed that they were actually in part of a study. There was also another study more recently in New Zealand that looked at cervical cancer or cervical cancer, which the same thing happened, that the participants weren't informed that they were actually in a study and that they were having things happening to them. So these sort of studies highlight a need for ethical conduct in research. So what sorts of things do we need to consider when we're looking at ethics in research? Well, we need to be able to do an accurate assessment of the benefits and risks to people. So look at what are the benefits of conducting the research, and what are the risks involved for the participants. We need to respect the participants, and we need to have them give informed consent. And what that means is that the consent should be voluntary, it should be based on sufficient information, and adequate understanding of both the proposed research and the implications of participation in it. We need to look at justice, which is looking at fairness or equity. We also need to look at the confidentiality and privacy of any information. We need to ensure that the data is used responsibly and respectfully, and that the privacy of participants is safeguarded. Confidentiality means that we don't use private information without consent, and that we have special ways of safeguarding that. So what is the role of human research ethics committees? Well, these play a central role in the Australian system of ethical review of research proposals to ensure that they meet the requirements of merit, justice, beneficence and respect. So who has a human research ethics committee? Well, all publicly funded institutions, for example, La Trobe University and other universities, health facilities and other organisations. So who sits on an HREC and provides the advice and does the review of applications? Well, there's a chair. There are lay people, which includes both men and women. There are people with a knowledge of professional health care. There are people who have pastoral care. You might have someone who will give advice on an Indigenous research. You'll have a lawyer and people with research expertise. So when your research proposal is being reviewed ethically, what do you need to include? You need to include information about the proposed research design and the procedures involved, who are the prospective human participants, how you're going to recruit them, how you're going to ensure that they give informed consent to participation in the research, and you need to give information about the possible impact of the research on participants and others, and you need to be quite vigilant about the control and storage of data, which means that if you undertake some research, you don't leave the data sitting out for all to be able to have a look at. So usually that's locked up in filing cabinets or in locked offices. So I've just given you a brief oversight of what ethics review and what ethics in research is. And I think one of the biggest messages I'd like to give, that undertaking research that is ethical is a fundamental responsibility of all researchers.